Hi, Dr. Kuipers.
Good evening.
How is the weather there?
No, it's just springtime. It's glorious.
Oh, okay. In Vancouver, heavens finally came back.
Well, that's yeah. We get pretty much the same weather you do, so it's been mild and sunny, and it's
Yeah,
a breath of springtime.
yeah. Today, let's talk about cholesterol and then why cholesterol related business are such a good business. By the way, how many cholesterol drugs do you prescribe in a week?
Working in the emergency department,
Okay,
I very rarely prescribe cholesterol drugs just because
okay,
that's not my area of
okay.
practice.
Yeah,
Although I must say, and this is something we should probably explore, is cholesterol lowering drugs, especially the statins, um, are not without side effects.
yeah.
And so I probably see more side effects than I actually prescribe the drugs. So I'm usually, if and when I see them, I'm telling people to stop it rather than prescribe it.
Oh, is it right? The statin is the the most successful pharmaceutical commodities. It is the biggest seller.
Yeah.
Statin, yeah, because there used to be debates, controversies whether high cholesterol is really good. Is it that bad? Oh, yes, no, yes, no. Is statin effective? Is statin good? Yes and no. But these days, kind out of many larger samples and then many years of controversies, I think there appeared a consensus that lower cholesterol level is actually good, and then statin actually lowers this bad cholesterol and then raises high cholesterol, high density cholesterol, which is good cholesterol. So it helps the human body. That seems to be the consensus right now, even though we all know of its side effects.
I would agree. It is a consensus based on large population studies,
Yeah, yeah,
and it's been around for decades now. Um, there's a quite a number of cholesterol lowering statins,
yeah,
and it's tough to tell though on an individual basis um, what a statin does for you. In a way, it's a little bit like um, high blood pressure medicines. I mean, if
yeah,
you take it,
yeah,
um, for all your adult life, and um, let's say you don't have a stroke, or you do have a stroke, it's often tough to tell whether or not that blood pressure medicine is responsible. So it's you have to look at large population studies and the individual
yeah,
really figure out what the risk versus benefit
yeah.
is. There's no
The
question that the statins lower the risk, but can you apply that individual benefit to yourself? Does it keep you from having a heart attack, or would you still have a heart attack at 75 instead of 70 if you were taking it?
yeah,
And that's
the
true of a lot of the drugs and medicines that we use today.
Yeah, that's a very cautious statement from a scientific viewpoint. Let me offer my viewpoint as a business person, okay? The reason why we sell this is one of the best seller of our company actually. The we did a survey of doctors, medical doctors. We asked them what are the drugs they are taking as preventive drugs for prevention, not because they have diseases, but because they want to prevent some serious disease later. They just take some drugs. What drugs do you take most as prevention prevention drugs. And consensus is this statin. Statin is what they take as a prevention disease, prevention drugs. And then once they say that, and then we tell them, we give them, we have natural substance that has the same modes of action as this pharmaceutical statin drugs. This is from red rice, and it has no side effect because we also found ways to reduce the side effect of this natural substance using natural method. And then when we just show our data, a lot of doctors buy our product.
Well, I mean, that speaks to the point that there are a lot of individual extracts like red rice extract and so on, but in terms of a tested natural product with thousands of patients worth of experience, I think your product is probably the only one that I'm aware of.
Yeah, our product name is R2, and then we found this substance from ancient Chinese pharmacopoeia, and then after so many years of providing data and experiment and clinical test, we recently obtained approval from Canadian government, and then because of all this data and because the doctors know the value of this thing, and doctors also are worried about the side effects. So if we tell them this is a natural stuff, and then we did reduce the side effects, even that we did a natural methods, they just love our argument, and then they just buy our product very much. And then as you told me, they believe that they have to keep on taking this thing during the adult life. So once people buy it, they tend to be a long-term customer. Especially, Dr. Carl, especially recently, I read some studies recently in our company, 20% of our Korean distributors have heart attack and myocarditis. And then they were hospitalized in emergencies. And then we believe that it has something to do with corona epidemic. And yeah, and then almost everybody was taking our this natural cholesterol lowering substance, which we call R2, and people who took this thing didn't have this. Yeah, let me admit that this is a small sample, but we know that in order to prevent this cardiovascular accidents, it is very important to take this blood clotting reducing the substances such as this statin and such as aspirin. And once people have these problems, they took our product and recovered very quickly. So we really emphasize the importance of taking this drug. But I'm just telling this thing. I didn't do the big study, but I see what happens inside the company, and then around myself, so many ordinarily very healthy friends all of a sudden got this heart attack and myocarditis, and then the arrhythmia. And then so I just tell them, I recommend to all of them this natural substance, which works exactly the same way as statin. So we sell this thing quite well these days, actually.
Well, I agree with you. I think that in terms of a preventive medicine drug that people are aware of, it's kind of like people are tuned in through the dint of mass marketing and years of advertising and so on, that high cholesterol is bad, low cholesterol is good. So you got to take something to lower your cholesterol. And so I think that that is probably the number one preventative medication used. It doesn't, and it's one of the few things that works pretty well all by itself. So if you really did nothing else for yourself, didn't exercise, didn't lose weight, uh, didn't watch your diet, there's always statin, which will lower your cholesterol and make you feel good, like you're at least doing something for yourself to
Yeah.
lower your risk of having a stroke or heart attack.
Yeah. So the doctors with the personal or family history of these cardiovascular diseases, they tend to take our product more. But there are studies and then the reasons to believe that the statin, as well as our natural replacement of that chemical statin, they have anti-inflammatory effects. And then because of that, they have a high anti-cancer properties. That's really important. So in China, this substance has been used as a general health booster for many years, for many probably thousands of years. So the reason why we found the natural ways to reduce the side effects of this product is, you know, in China, when they use one herb, they seldom use standalone herb. They usually mix this herb with this. So they kind of build a prescription set, combination of herbs to reduce the side effects and then to strengthen the good effect. So we studied what are the herbs that are used with this substance, and then from many candidates, I can say we found a way, cook right way. So that's how we reduce the side effects.
Sure, on that. And that raises a point that we've talked about before, is the fact that a drug such as a statin that you would buy by prescription at the drugstore pharmacy here is a single chemical compound. As a result, that chemical compound may have effects at different sites within the cell, and the production of cholesterol and so on by the body is a multi-step process. So it can affect that at many steps, and as a result, cause other effects that may be beneficial or not so much. Whereas I think by trial and error, ancient pharmacists and herbalists learn to mix and match other herbs and ingredients, which are multiple chemical compounds in and of themselves, because they probably found that, well, this might have a good effect, but have some side effects. So we add this over here that seems to ameliorate or reduce those bad effects. So you can have the advantage of minimizing the bad effects and increasing the wanted effects.
Exactly. You raised a very important point in it. I can prove logically using this philosophical framework that anytime you use one single purified substance, it causes serious side effect and then it develops resistance. So, for example, if let's say if bread is originally a very complex combination of many kinds of carbohydrates, right? So if you purify it, if you synthesize one single substance that does exactly the same thing that does the bread, and if you take it, probably 1 or 2 days you're fine, but if you take it over and over and over, it develops side effects and it develops the resistance. Let's say water. Even the water, the chemical formula is H2O, two hydrogen and one oxygen. If you really purify this the chemical substance, and then if you make the pure H2O, if people take it, they have just diarrhea and you cannot absorb. Our human body is not engineered to take those purified chemical substance. We are through the many years of evolution, human body can take only the substance in a complex, mild, infinitely complex, this in a sense chaotic, the complex substance. That's the only thing human body can recognize. Human body cannot recognize those pure chemical things, but the these pharmaceutical companies always make this pure thing, and then so of course they are inviting problems themselves.
Exactly. Uh,
And then as you always emphasize uh, the let me give some lifestyle substance substitution of this chemical cholesterol drugs, such as we should reduce saturated fats, and the trans fats, and then we should eat more omega 3, and then the uh if in the grocery, on the label of boxes, you may see this thing reduces cholesterol. That's because it contains fiber. Then uh, the government allows the manufacturer to claim that it reduces cholesterol. So, and then with all this kind of lifestyle changes, and then our natural statin, I think we can, in our case, many users of our product replace the pharmaceutical statin, and then they can go completely natural and then maintain healthy cholesterol levels. That's why we are very happy. And you can find all these testimonials on the YouTube if you search Eleutin, which is our brand name, and the Eleutin and cholesterol. If you search like that, you can find lots of testimonials that, oh, we use this thing, and then I quit pharmaceutical statin, and I my cholesterol levels are at healthy normal level. There's many, you can find many of those testimonials. Yes.
well, I think, and again, you raise some good points that, especially with like fiber and and some of the other things, reducing saturated fats and increasing exercise, we know raises the good kind of cholesterol and lowers the bad. And a lot of times, if you do these things, then you perhaps don't need quite as strong a dose of the statin, or you can use an alternative such as R2
Mm.
instead of having to
Ye-
brave the statins.
Yeah, I'm asking this question because of my recent encounters with a few cases that the people complain that uh, they experience loss of memory loss, and then dementia after they took statin. And have you encountered such cases yourself?
I have not seen that particular side effect in my experience.
Mm.
Uh, I think the primary effect or side effect that I have seen, myself included, is muscle cramps.
Oh, yeah,
Um,
yeah.
Muscle cramps, I think, is a very common side effect with the statins.
Mm.
It's not serious or debilitating, but it's kind of very annoying,
Mm.
and uh, it's a known and recognized side effect of which there are many. Especially, the longer you take it, the more other medications you're on, the risk of side effects goes way up.
Yeah.
And
Well, you raise a
sometimes
very, yeah,
there's
you raise
no
a very, go ahead. Yeah.
alternative to just stopping it. And if you know about or are aware of other alternatives, then that makes a lot of sense, that if you can't tolerate the statin, then try something different, maybe something as gentle as R2, and see what happens. The other thing is, effect of the statins isn't very quick. It generally takes 3 to 6 months of being on it before you can notice a measurable difference in the cholesterol. So that gives you a fair amount of time to see how it's gonna play with your system.
You raised a very interesting point. The muscle cramp, as you think, is the most frequently complained side effects of the statin. That's that happens because statin reduces such an enzyme called CoQ10. That's why it causes this muscle cramp. And then, just a moment ago, I mentioned that we found a natural way of to cook this formula using natural means. Actually, our natural means to cook this natural substitutes of chemical statin is actually reinforcing CoQ10, which happens very often when people take statin. So our product's main, what should I say, main comparative advantage in theory is just we don't have that side effects of such as muscle cramp, muscle loss, muscle weaknesses. So the that's one of the attractive points of our product.
Well, and that's a very attractive point because many people are actually taking supplements for CoQ10. And CoQ10 is is an important enzyme factor in cardiac function and blood vessel function. So it kind of is like why would you take two things, or you take something to counteract the deleterious effect of the statin when you could take R2 and achieve the same benefit without having to take extra CoQ10 to avoid the loss.
Yeah. So let me just cite a few more side effects of this chemical statin, which is constipation, and then dark urine, and that it increases seriously the chance of diabetes, and you get flu more often. Actually, it increases the risk of stroke. And because of these muscle problems, you get injured during the sports. And then it has some contradiction with such fruits like grapefruit. And then it has contradiction. It has a counter contradiction with 50 kinds of other drugs. Okay. So if you have a statin, you are taking other synthetic pharmaceutical drugs, there's a problem. It just collide with each other. So in my mind, it makes a lot more sense to resort to natural substance rather than there's a pharmaceutical chemical substance, and then I really believe that our product has more advantages over chemical substances.
Well, it's pretty obvious that statins have one of the longest list of side effects and contraindications of practically any class of drugs there are. But I think the benefit of lowering cholesterol and raising the good kind of cholesterol is definitely something to shoot for and is very beneficial. So I think it would be, if you can't take the statins, then take R2. And if you don't want the contraindications to begin with of statins, take R2.
Do you have a last point? If you give me a last point, then I have one last question for you.
Well, I think that was my last point, is like, if you don't want the side effects of the statins, then take R2. And if you can't take a statin that you've already been on for some time, or you're dismayed when some of the contraindications and side effects that you just listed come up, then get off the statin and try R2.
Dr. Kuipers, I'm asking this point blank questions. Would you buy our product?
Yes, I already take it. Personally, I tried taking the statin a couple of years ago,
Yeah.
and I had muscle cramps and that I found intolerable, and so I switched to R2 as soon as I found that it was available.
Okay, thank you very much, Dr. Kuipers.
Thank you.
Yeah.